Dr. Hawary, we talked about missing teeth and how missing teeth can create, obviously they can make you missing other teeth in it, which is in itself not good and creates more problem, and it becomes very expensive to fix them down the road. They can also create headaches and muscle tensions. Now that's a big problem because, when we have headaches and muscle tensions throughout the day, we become less productive, we become irritated. It's just not good. Give us some of the ways, the 2 or 3 most important, and or maybe those are the only one. Give us some different options on how to fix them, and shed a little bit of light on why one might be better than another one, or when are the different reasons. Maybe there is not one which is better. Maybe there are just different reasons one to use. Give it to us, fast in a big overall picture, please.
Missing teeth can be restored in one of 3 ways. Either a removable appliance, which most people don't feel as natural as regular teeth, which can be for full edentulous people, like the full dentures, or it can be partial dentures. These are removable ways. Better than that, the bridges, fixed bridges. We have been doing bridges for so many years, and that's also a very good option. It's not the best option, but it is a good option because it's fixed, it feels more natural, providing that there are enough teeth, healthy teeth, okay, neighboring to the space. Hello?
Yeah, I'm here.
The screen is gone.
Just touch it. It's your screensaver, doctor.
Okay, I apologize.
That's all right.
I thought that the battery is gone. Okay, so we'll start over, or what?
No. Just keep going, doctor.
Okay. Bridges are a good option, providing that there are teeth, okay, besides the missing teeth. They are healthy, they are strong, they are not mobile, and they are not weak. That can be utilized to anchor the bridge too. That's the other second way. The third way, which is the best way, is to replace the missing teeth with implants. Implants would be the best way, providing as well that there is enough bone that would hold the implant inside. And an implant is an artificial root that we place into the bone where the missing tooth and the root used to be, and we build it with on top of that in a very simple description. So we're not...
You're basically sticking in an implant. Basically is a metal screw which is made out of titanium, which is the same material they do hip replacements these days. It gets screwed into the bone, it grows beautifully around, and that kind of like that replaces, like it feels to the bone or to the body like an original root being there, and then you stick a crown on it, or a cap as you call it, the same way you would if you would put a crown or a cap on a somewhat broken tooth.
Absolutely, and the best thing about that we don't utilize or grind or file the teeth neighboring to that. We're just depending on the bone, and it's a stand-alone tooth that has no pressure on the other teeth, which is healthier, better, feels more natural, allows the patient to floss, which is things that don't come with the bridge. Bridge means people don't floss. They are not individual teeth. You find
there are basically 3 on a bridge. There are basically 3 or more teeth, kind of almost welded together, right? Because you have the anchor teeth on the side, and then you put a crown on it, and you hang another 1 or 2 whatever teeth in between, and they're all together. So flossing becomes difficult because now the person has to go under the tooth.
Yes.
And of course, dedicated people like my wife, she would have no problem with that. She would do it. A little more sloppy people like me, I can see how I would miss it sometimes, maybe sometimes often. And what would happen? Major gum disease? And a bridge failing again?
I mean, a bridge here has the gum potential problem because of neglect of flossing and the hygiene care that is needed that it comes with it. But also other many problems, like, for example, we file the teeth next to the missing tooth, and that weakens those teeth, and sometimes they end up with root canals, and sometimes one of these teeth fail, meaning we have to extract one of these teeth, and now the bridge, instead of missing one tooth, missing two teeth, and it snowballs, and it costs more on the long run if we replace one bridge by another versus having an implant, protecting the teeth, keeping them natural, and don't touch them.
Right.
So an implant in any time when there is bone enough, it is a way better option that dentistry provide today.
Well, you just reminded me of something about, you said if you have a bridge with 3 or 4 teeth on it or whatever, and if one fails, the whole bridge basically is failing. It needs to be redone. It was about a year ago, I bought this, I thought I was really smart, and I bought this printer, copier, scanner, fax machine, all in one, 4 in 1. I thought that was really wonderful, and the price was good, and it was all fine and dandy, until one of them broke, and then I had nothing. So, all right, I see that. Now, some doctors tell me, when a side tooth is, one of the teeth where you put a crown on it to hang a bridge, if that tooth is already broken, if already has problem and you need to put a crown on it, then a bridge might sometimes be okay because the tooth is already damaged. You're not damaging it anymore. You need to work on it anyway. And even there, some dentists tell me, well, even there, you should then put one crown and one implant because at least you still have them separated. Well, what's your take on that?
Yes, absolutely, because the same thing. The tooth that was weakened already and broken, even if it has a crown, it has already the problem of its own. Now you put this as an abutment for a bridge and put the load of another tooth on it, more problems will come down the road. And this tooth that may not have a root canal by now it needs a root canal and becomes a dead, fragile tooth that's subjected to fracture easier, and that's what would come next. So in my opinion, at any time, if we can do the bridge, do the implants, instead, and avoid putting pressure on that tooth, even though it has a big filling or a crown, we avoid a lot of problems in the future, especially when it fails. We have to start over, spend more money on that. An implant, in the other way around, it's a standalone tooth. If you have a problem with the other tooth, we deal with one tooth, not with 3 teeth, and sometimes not with 4 teeth. So it's always better to have each tooth by itself.
Mm-hmm. And what about, does the implant really help? You see, I hear you dentists saying that when a tooth is gone, the root is gone and the bones shrink, and that's when you get that caved-in look, like a dried-out tomato look, like an old person look, like our grandparents used to look. They looked, very fallen, caved in, maybe in front, everywhere. So when you have lots of bridges, is the likelihood of that happening more than if you replaced it with implants?
Yeah, implants would preserve the bone, which is an excellent way of preserving the bone so we don't keep losing bone. So now we have a lot of times we place immediate placement where we pull the tooth and place the implant in the same visit, and we prevent the bone loss as much as we can. So as if we have never pulled the tooth. In that scenario, especially the bone that's supporting the face and the muscles, okay, and look older, have wrinkles, all of that will be avoided by placing the implant in the right time when there is a lot of bone. The success is better because there's more bone, and we preserve the muscle faces better.
Beautiful, Dr. Hawary. Again, I appreciate your candidness. Very informative. It should let patients a little bit know what they should expect, what questions they should ask if and when they go to a dentist. There's obviously a place for all treatments. There is, however, why not do it right the first time? Because a few years later, even if it is a decade later, you'll have to go there and do it again anyway. You might as well do it right the first time, kind of. Is that kind of like the basic idea?
Absolutely. Many